Welcome to Facebook Live. Before we get started, I just wanted to make a quick announcement. We've been nominated for Milwaukee's A-List, and we're really excited to show what the MSWC difference is. So if you haven't had a chance, please hop on. We've got links on our website and our social media pages, and give us a vote if you've had an experience with us that you think is worth sharing. Today, we're going to talk about why you should not be afraid of chiropractic adjusting. The reason that we want to talk about this, we're kind of in Halloween month, so we're kind of piggybacking off of Halloween, but some people are very afraid or nervous about chiropractic adjusting. Sometimes you get noises, pops, clicks, and that can scare some people. Some people have seen some bad media or have had some inaccurate information out in the community, and so I just kind of wanted to talk a little bit about what chiropractic adjusting is, what those noises are, and a little bit of the research behind it. So the first thing to recognize is that popping, clicking, the noise that you might get with an adjustment, just like when you pop your knuckles. Not all adjusting techniques give you that sound, but if you do get that sound, it's what we call a cavitation. That cavitation is literally primarily just air bubbles popping inside of a joint. It's not harmful, it doesn't hurt anything, and there's nothing really to be worried about it. We're not damaging structures, we're not ripping ligaments or tissues, anything like that. It's just the cavitation or the noise of a joint opening and closing really quickly. The second thing is kind of some information out into the community or in the media that sometimes you might hear about, or just a fear of the unknown. And there's been a lot of research that's been done about chiropractic adjusting, especially in recent years, taking a look at what the risks are. And I just kind of want to cite a couple bigger studies that give an overview. Our highest risk of population is the geriatric population. So several of these studies looked at populations ages 66 to 99. They looked at Medicare records, and they looked all the way back through over 1 million patients in several of these studies. And they were looking at the risk for patients that seek out medical care for neck pain, back pain, headaches, common things that might be seen in a primary care doc's office or in a chiropractic office. And they compared risk levels. And what they found is that the risk levels of an office visit with a chiropractor compared to an office visit at different types of professionals, like a primary care doctor, was actually significantly low. And if you want to check out some citations, we'll have some of those here in a little bit that you can look at. But just something to kind of exaggerate or something to kind of talk about is the fact that people come in with pain to a chiropractor. They come in for a reason, but the actual risk of the adjustment is very low. The risk coming out of an office visit is very low. There are reasons that you should not be adjusted, or we might not want to use adjusting, and that's one reason that chiropractors do exams before we treat. It's just like anything else. There are risks with medications. We need to know if it's the right fit for our patient. There are some risks with adjusting and some patients that shouldn't have certain types of adjusting, and so we do our exam first. Those exams are very highly trained. Chiropractors go through a 4-year doctoral program as a graduate program, so we have to go through undergrad and then an additional 4 to 5 years of training in order to become a chiropractor. We're licensed as primary care providers or full-level physicians in most of the 50 states. Our schooling is very similar to what you would give to an allopathic, an MD, or an osteopathic physician, a DO. There's differences obviously in the specialty, but similar to medical school, we've got over 4,200 hours of classroom, laboratory, and clinical rotations. And so we get a lot of science and pathology and anatomy and physiology and all the important things that kind of go into how the human body works and biomechanics. So I hope you've enjoyed this little segment. Feel free to check us out on millerswc.com. And like I said, those citations will be posted for you shortly.